Hi, my name is Dr. Tiffany Jackson Johnson, and it's 7 o'clock, so we're going to go ahead and get started. On behalf of the Torp University, the Student National Medical Association, and the Latino Medical Student Association, I'd like to welcome all of you to our OB-GYN panel. We're going to discuss particularly the residency interview process in this time of COVID and how to address some of the challenges of applying this upcoming year. We all know that how important interviews can be to getting a residency spot, and given the changes that we're seeing and how we're going to be doing them, particularly virtually, we felt that it was important to discuss how to help all of us excel and do the best that we possibly can throughout this process. So especially for our underrepresented minority MS4s, such as yourself, who are going to be applying into this relatively competitive specialty. We just wanted to make sure that you all are putting your best foot forward and have an opportunity to ask any questions and get some exposure to this new interview process. So before I introduce the panelists and ask them to introduce themselves, I'd like to just encourage all of you that if you do have questions, this is going to be a very Q&A format. We encourage you to use the Q&A function on Zoom, and that way we can answer all your questions throughout the next hour or so. So starting with myself, again, my name is Dr. Tiffany Jackson Johnson. I'm a new OB grad from residency. I went to Illinois Masonic for my training, and I'll be starting on Monday a job at Erie Family Health Centers working at a Northwestern hospital. So up next, I will ask Dr. Brugge to introduce herself.
Hello, I'm Pamela Brugge. I am an OBGYN. I'm definitely not new. I am now in practice for 25 plus years, clinical practice. I am on this panel because I also serve as an OBGYN mentor to an osteopathic school.
Dr. Ayers.
Hello, my name is Charlotte Ayers. I trained at Temple University as well as did my residency there. I'm now the vice chair of OBGYN at Robert Wood Johnson Medical School in New Brunswick, New Jersey. One of the things is that from my experience, I've been an OBGYN for 27 years, but also a mentor for medical students, residents. I also am the director for Urban Global Scholar Fellowship at Robert Wood Johnson.
Dr. Baffo. And I apologize for mispronunciations.
No, you got it right. Hi, everyone. My name's Eileen. I am currently a PGY3 OBGYN resident at Rutgers Robert Wood Johnson Medical School. Just a little background, I went to Rutgers for undergrad in New Brunswick, New Jersey. And then for my medical school, I went to the University of Southern California, and I made it back to New Jersey, back home for residency.
Dr. Atkins?
My name is James Akins. I am a gynecological oncologist and also the program director for the Gynecological Oncology Fellowship, which I started at Robert Wood Johnson Medical School at the time. Now we are known as Cooper Medical School at Rowan University. And the fellowship has been around for about 12 years. I've graduated 10 fellows. Half of them are in private practice and the other half are in academic practice. We are based in Camden, New Jersey.
Awesome. Dr. Green.
Hello, everyone. My name is Ashley Green. I actually originally from Maryland. I did my undergraduate education there. I went to SUNY Upstate Medical School in Syracuse, New Jersey. I also did my master's there. And now I'm a fourth year OBGYN resident here at Rutgers Robert Wood Johnson.
Awesome. And Dr. Dunlap Wright.
Hi, I'm Dr. Dunlap Bright. First name's Shonda. I did my residency at Mercy. I went to Philadelphia College of Osteopathic Medicine. I am also a new grad. I just graduated from Mercy on June 30th. I started working in Indiana August 3rd, so I'm a brand new attending with Community Care Network out in Valparaiso. Happy to be here. Thank you.
And a special thank you to Dr. Darko for helping to put all of this together, but we're gonna jump into questions. Again, if you have any questions that you'd like for us to answer, feel free to put them in the question and answers function on Zoom. But just to get us started, if anyone could comment on what proportion of underrepresented minorities would you say apply into OB-GYN residency, and how many of those that apply do you think are ultimately accepted? Like, what are your just thoughts or feelings on what the general acceptance is for underrepresented minorities in our field?
I'll start with that question. Having over the last 20 years, I've seen that there is an increase of minorities being accepted. I think, though, that the majority of our students that are coming, underrepresented students, are very well qualified. And I think the reason why you're seeing that, what we're seeing is that those are the individuals that are getting past the preliminary review. So I think the majority of the majority of the students that we see actually interviewing have already gotten to that level of getting past the evaluation and getting an interview at that time. We really don't know when we're processing students to try to have not bias. The majority of times we don't see pictures of students. We just see their credentials. So we try to be non-biased when they're evaluating students that way. But I think those students who do get past that point, they are probably 80% of them, more like 90% of them are getting residencies, the ones that we are interviewing. I think the other question is how many of those who are applying do we think? And I'm not sure we know that number, but I'm sure we're going to get to that point where we can answer those questions of what is the more likelihood of those who will be accepted in an OBGYN residency than those who are not.
Awesome.
In OBGYN is actually the most diverse specialty in the medical field. I agree with Dr. Ayers. We don't know how many are actually applying, because usually the initial process is not actually done, in most programs are done by program assistants or program managers and not the program directors. You know, there's a weed out process prior to, and then the applicants that do that initial, meet that initial requirement, then are passed to the program directors.
Absolutely, thank you. There is a question in the Q&A, and it states, if you're interested in a program that has absolutely no Black residents in all cohorts, what is the best way to go about asking how the program plans to change that in the future?
I think, sorry.
No, go ahead.
I think when you go on your interview, there are questions that like this that are going to be asked, like, what can you bring to the program? How can, what can you attribute to the program? So if you know you're going to a program, you're very interested in a program that has no Black faculty, no Black residents. First, I hope that you are really interested in the program, because you want to be somewhere they're going to foster your learning and that you're not dealing with a lot of microaggressions. But you should ask them, you know, how do they value diversity? What type of patient population are they working with? How do they see themselves in the patients? What do they do to limit their bias against the patients? And then that way you can see if you feel like you're going to be comfortable at that program as well, to make sure that you're not in a constant fight trying to get diversity somewhere where they might not want to even value change. I know a lot of residents that were the only Black or brown or non-white person in the entire program, and they were able to foster change there, but they made sure they were able to bring it to the table, and they weren't afraid to say, I'm here to not only be a person of color, but also show you that our patient population is important and we need to change that face and how we treat our patients. So make sure that you're willing to fight the fight along with the program when you ask that question.
I also think another thing, kind of touching on what Dr. Wright said. So when I was, that was something that was very important to me when I was looking for residency programs. And another thing that I wanted to keep in mind is that residents come and go. You may have a Black resident when you apply, but they could graduate, or you may graduate before them, but the faculty is who's there and who stays. So pay attention and look at who the faculty is and how many Black or brown faculty members there are, how supported they feel. You can ask, you don't have to ask them in a large group, but you can ask them at the side, how do they feel? Do they feel supported? Do they feel like their issues are addressed when they're brought up? Things of that nature.
Certainly. For the last 3 years of residency, the only two underrepresented minorities in my program were myself and my classmate. And I completely second the idea of also checking into faculty. Actually, given everything that's going on in the world, one of the faculty members even reached out yesterday just to check on how I was feeling and how I was doing. And I think that was a constant source of support for me in residency after the other Black chiefs who I had when I was an intern, after they graduated, the faculty kind of became my main support system when it came to those things, and they remain that way now. Anyone else want to weigh in? If not, we can keep going to other questions. Okay, so kind of on the same vein, but what do you think programs are doing or should be doing to appeal to underrepresented minorities?
In the programs that I've spoken to, they actually don't have, in particular, a reach out or a outreach program for underrepresented minorities. There's one program that actually did start up in the last year. It's been a year now. Diversity for all of their programs under GME that deals with diversity and inclusion. I think that in this day and age, and because of things that have actually happened in our communities and throughout the nation, I think more are asking about it or trying to figure out what they can do about it. But I don't think in the past that there's been, in particular, programs set out for underrepresented minorities.
I have to agree with Dr. Brook. I think that's one area. I don't want to be negative for OBGYN. I have not seen specifically, and maybe some of my younger colleagues might have who've done it more recently when they were on the residency road of interviewing. I didn't really see an aggressive reach out. I do know in some pediatric residencies, they do have actual reach out where they have a separate time where they really recruit underrepresented minorities, and the faculty and some of the residents participate in that. But I have not heard for OBGYN. That's not saying it doesn't happen. And it's not saying that that's something that we really probably should look more into. But I think one of the things that you can look at is, are they really, when they're making their pitch, especially now this virtual, are they talking about diversity? Are they talking about engagement for diverse populations within the learners as well as the patients. And I think that's one of the things that probably are in most people's mind. And I think that's something you should look into when you're going and interviewing at different institutions.
Yeah, when I was interviewing or on the interview trail and looking at all the different programs out there, I didn't have anyone actually saying and actively recruiting for underrepresented minorities, especially not in OBGYN. I don't remember hearing it in my other, in my friends, for instance, in like pediatrics. I don't think they were actively recruited. I think we all kind of went along the lines of incorporating it into our questions when we were actually in the interviews. And just if the question wasn't brought up, or we would always figure out how to segue into asking, you know, how do other faculty members or other residents of color in the past, how have you guys actually made those residents, made those faculty members actually feel like welcomed, and have there been any programs in the past, but I haven't been actively recruited.
Just one thing, during my residency trail, so there were some programs that had, I guess, a separate interview dinner for minorities, and it wasn't specific to OBGYN, but it was just like some programs that had, in all of the residencies that were applying, they had a dinner for the minorities so they can meet each other, or some sort of outing, but that was rare, and I didn't end up at a program that did that, so I can't really speak on how it is, like how the relationships fostered during residency, but I know that maybe if that's something important to you, look out for the programs that have those sort of opportunities beforehand.
Absolutely. I think some of it is representation. I know for me, if it was an interview day, I would actively tell my program director, look, there's like 3 Black applicants tonight and a couple, 2 Hispanic applicants. I think I should go to the dinner, even if that means somebody has to cover me in the hospital, because they should probably see my face. And I think those conversations got some of the administrators thinking about it, but I would agree that it wasn't on the forefront of recruiting or people's thought process going into the recruitment process. So we do have another question. It states, given the information relayed about the program directors or program coordinators screening students, as an IMG student, how can one make themselves more competitive aside from test scores, particularly if the school isn't well known? And for those who may not know, IMG means International Medical Grads.
I think one of the things that they look at, and this is a difficult question because I think it really depends on the institution. So I'm going to generalize a little bit regarding this because some programs interview international students and others may not. But I think research has been found to be something of significance. Some other students that have done other things are specific rotations that they've gone to where they've worked with individuals who are really recognized within the OBGYN community, and then obtain a letter from those individuals, I think has been very helpful. I think those are the 2 things that I come to mind that will be helpful for that particular individual.
I think I agree with Dr. Ayers. In OBGYN, as competitive as it is, it's at times very difficult because that a portion of the selection criteria is where you graduated from. And so IMG students are actually don't pass the selection period to go on to interviews in quite a few programs, at least in the area where I know the best, which is in the Northeast. One of the things that has been recommended is to actually get a master's degree and do then some type of research with a known faculty member. Whether it's in Masters of Public Health or an MBA.
Awesome. Another question is, in this virtual age, how are programs ensuring that applicants don't schedule multiple interviews on a single day? Which is kind of a new, interesting twist.
I thought that everyone is using the same platform that has been I'm sorry, that escapes me right now. But there's only one platform right now, and all the programs have been given this platform for free to use, and it does the scheduling for interviews. And it does not allow for you to actually book 2 interviews at the same time, supposedly. Remember, this is all new, and they're going to try to, you know, they're basically piloting this platform.
And I would just recommend too, being very careful of that, because I think that everyone is working through this process, like Dr. Brooks said, even at our institution. And some of the programs are doing all day events. So you don't want to get caught into a issue when you're just assuming and they say, okay, I want to switch you over because I really see you're interested, and let me have you meet up with Dr. So-and-so, and you now have another interview. So I would try to do the same thing that you would do for when we were doing face-to-face. I think that, and especially with this being new, you don't want to have a negative, any part of your interviewing process negative, because that's the only time that you're able to actually show yourself. That's the time that you're able to impress those individuals who's making that determination of you becoming a member of their team, being part of their residency. So I would just caution anyone who would try to schedule more than one at the same time. That's just my opinion, though.
Yeah, I agree. We haven't, at least on a resident standpoint, with how the interviews are going to go this year, given everything needs to be like virtual. My co-residents who are applying for fellowship now are on their interviews all day. They have interviews and meetings and information starting at like 7 in the morning, and sometimes their interviews don't end until 5, 6 p.m. at night. Not to say that ours will, but sometimes there's things that happen, interviews get switched, just like Dr. Ayers said, you never know if we're gonna switch you to someone who you might be more interested if they just got out of a case or just got free and available to speak with you. So I would absolutely not schedule unless the program specifically said, we only wanna talk to you for this hour to follow up with something, but I wouldn't schedule 2 in a day. You have no idea what's gonna happen, and it could look poorly on you if something happened and you weren't available.
I think I agree with everything that has been said so far. And the best advice is what everyone is saying, that do not schedule more than 1 interview a day. We just finished our fellowship interviews, and it's all day affair. So I know it's a fellowship situation, but it goes the same with a residency. You know, doing the same thing you would do if it wasn't virtual. You know, 1 interview at a time, not more than 1.
And I think in regards to all of this, I think everyone needs to remember that even though OBGYN and we're a large nation, the OBGYN is quite small. And so you don't want to do something, as been said by Dr. Ayers, by everyone, that will be negative, but will also stem a conversation with someone who you may want to get into their program. It is a small world.
Absolutely. The last thing you want to do is mix up the two programs that you're potentially scheduling on the same day, and that wouldn't be ideal either. So going back to another question, kind of back to something we've touched on before, how should the applicants respond to programs that talk a lot about diversity and inclusion, but don't necessarily walk the walk, and their residents and faculty don't reflect their efforts?
I would say actually like talk to the residents, especially if they're able to like provide a pre-interview. I guess it won't be dinner now. I think every program is going to try and figure out how to do a pre-interview meetup with the residents. Typically what we did outside of COVID was have like a dinner at one of the residents' apartments or homes. So that way you could talk freely and you'll be able to see, you'll see the body language. You'll see, sorry about that. You'll see the body language. You'll be able to see if right off the bat, they're talking about programs or things that they do within their university or within their hospital that promotes diversity or inclusion, even if the resident and faculty don't look like they are actively working on that. You'll be able to tell from what they're saying and how they respond to you.
Dr. Dunlap, any thoughts?
I was going to I was going to chime in on what she says. It's really, I agree with what the last resident said. Basically, you do have to talk to the residents. You have to try to fill out the environment for yourself. People are trying to change. They may want to try to kickstart diversity within their program. So I would definitely not write them off. I would just try to see if you can genuinely fill them out. I agree with everything she said. I didn't really have anything to add.
Okay, fantastic. So next question then would be, what advice in general do we have for students kind of embarking on this virtual interview process in terms of getting to know the program and its current residents? You know, in person, you kind of get to know a lot about, you can get to know a lot about the people. So what do they do now that they don't have that opportunity?
I think that you can gather a lot of information, various programs, online. Um, and I think also a lot of the programs are making these YouTube videos describing their institution and what the program is all about. Actually, it's become the big thing that most places are doing to showcase, what the program is all about. And then also, do not be intimidated or be afraid to look up names of people and try to reach out to see. You can call the program director or even the program coordinator and ask, if there's someone you can talk to, a resident or a faculty, to more or less get more information about the program. I think most faculty members as well as residents are eager, to talk to applicants regarding, what they may want to know, since one cannot travel to these areas. And I think the sooner you do your homework about the institution, the better off you're going to be, because it shows. Because when I talk to people doing interviews, people who have done their homework seems to know a lot about my institution. And I think that's very impressive that this person is taking the time to evaluate my institution, to look up so many different things that we do, from research to publications to different programs that we have at our place. I think that goes a long way to show your interest. And also, I think you will benefit a lot, from that. So you got to do your homework and try to reach out to people. And then sometimes, you may even ask if there's a graduate that may be in your community that you can even talk to gather their experience when they were residents at that particular program. And I think all these are ways that can make you stand out from the rest of the group because, you know, it's very competitive specialty and you have to do everything you can to be at the top, to be recognized so that when the ranking day comes, people will remember you.
I think also, I think there's also very good references in regards to this whole new interviewing on the APCO CREOC website. And I would recommend that students basically go onto the APCO CREOC website. It has information in regards to interviewing, the whole process in the age of COVID.
Do you all feel like programs are going to offer more interview dates this year, given that it's virtual, or do you think it'll be the same amount of dates as usual?
Well, they apparently, from what I've been told, they've been set as a limit has been set. So a time period has been set. So depending on how they're doing their interviews, there actually may not be. I think more the program directors I've spoken to, they feel that they may be inundated with applicants and applications because there's no cost right now. You don't have to, if you get an interview, there's no cost involved in your traveling. So they're trying to figure out what is going to be the process to limit the amount of interviews that they actually grant.
Thank you. So I know something that all students are kind of bummed about is that sub-Is aren't an option this year. So what are some things that students can do to set themselves apart when they're not able to do sub-Is?
I guess I would say if you're still able to do rotations at your home institution, maybe do a couple more to show, like specifically in OBGYN, just to show interest and show that you're trying to get your feet wet early on.
Yeah, I agree. Because the more we're in terms of also residents and faculty are able to see your face, really know your interests, really know how you work. Even though you're not able to go out to other institutions, that helps towards your letters of recommendations. And even if we don't write a letter of recommendation, news travels, the field and the specialty is small, and networking is everything. So if, for instance, like our sub-Is, they work hard, and I know a resident, or I'm closer to a faculty member at an institution that she's really interested in, I could send a text message or a call. You never know who people know. And working hard, even if it has to be at your home institution, it will show, and it will be reflected in your work. It'll be reflected in the letters of recommendation. And ultimately your network is going to have to help, especially in this day and age when we're not physically able to see and meet people.
And also, just for you to know, I agree with both of what you said, but you have to understand that no one is having sub-Is going away. So I think I wouldn't have any of you get so concerned that that's going to make or break. So I think the institutions all know that you won't be able to come to their institutions and see. I think it's going to change how we evaluate a little bit and look at your what you've done at your home institution, as the residents has stated. So I think doing well on your whatever rotation you have, getting great comments from the individuals who have seen what you do at your institutions probably will be looked at a little bit more closely than before.
Oh, I have one more thing to add. There's also, I don't know what levels or what, like if you're about to apply right now or you're going to apply in the year coming, but all the conferences, like all these OBGYN conferences, like ACOG, for example, are still occurring, but they're just virtual now, which is a benefit. If you have the time, you can attend. And I'm sure there's some sort of like residency interest groups within this virtual conference. So look into some conferences and see if you can network in that way too, so they can actually physically or see your face beforehand.
And some of those conferences are free to medical students. So, or limited or not costing as much. So that's a great idea.
Thank you. And just a reminder to all the participants, we're taking questions through the question and answers function on Zoom. So go ahead and put all your questions in there and we'll get to them as they come. But another question, so beyond just the lack of sub-Is, another question that we have, that some have, is with board scores, if they are an issue, what are some things, if given that you may not be able to do an in-person sub-I or rotation at a hospital, what are some ways that you can make yourself stand out and other qualities to highlight?
I think that years ago, board scores were a big issue. I think now most programs want to make sure that they pass those exams. They don't want to accept anyone who can pass these tests. Most programs will make sure that the individual has taken step 1 and 2 at least and has passed it. Because they do use that criteria as more of a selection. I don't think the higher your test score, maybe so there are some programs that is looking for a top number. But many studies published over the years have shown that high scores does not necessarily correlate being an excellent clinician. And we all know people who are AOAs that can't cut. And if they do, they can't do anything. If there's a problem, they jump up and screaming. So I think most programs know that, but you want to make sure that you have taken those exams and you have them well, you have passed them. Now, if there are issues, for instance, dad was sick at a time he had to go take this test, we're all stressed out and things didn't go well, and you retook them and everything is okay. I think when you write your personal statement, you can address that at that point and to let them know what happened there. And I think most people are eager to accept those stressful situations and would not be some sort of a black mark on the individual. I think what most people look for is, what else have you done? We don't want to see just test scores. Did you do any research? Did you present an abstract at some kind of meeting? Are you involved with your community? Did you take a trip to do voluntary work in Indian reservation? Is there, how do you call it, a community clinic where you help, to take care of indigent patients? There are so many different things outside schooling that one can do to beef up their credentials. And I think those are some of the things that we all forget to do. I think we get ourselves in a glitch. When I interview people, I really don't want to know how well you've done in biochemistry or during that surgery rotation. I want to know who you are and what are you going to bring to my program? And what kind of unique things have you done? And how are you going to contribute? I think let's not forget, those are the unique things that most programs are looking for. Because, we all know you can pass the test. We all know you could get along, but you have to be able to have shown that, you have unique qualities that makes you stand out. And I think that's where we have to focus. I agree that, of course, if you haven't passed part 1 or part 2, most places probably not going to look at you. But once you got them once you pass those exams, you need to find some things to make you a unique person.
I think that beyond the board scores, I think what was said previously, that the letter of recommendations become very important. If you get past the criteria, because it seems that most programs are just going to use the board scores as their first screening. So if you can get past that, then the next thing is, what are your letters of recommendation saying about you? And so those become very important. And then after that becomes the personal statement.
Okay, thank you. So kind of moving forward in the process, once you finished interviewing, how then would you say most programs go about creating a rank list? Or what are some of the main attributes that they factor into their rankings?
I think that's an individualized question, but I think one of the things that we look at is, you know, how well will this individual fit into our community? Do they seem like they really would want to be there? Would they, once we rank them, will they come? Do they have support in many forms? I mean, one of the things that a residency program is concerned with, especially in OBGYN. OBGYN is a very exciting field, and you know, I love OBGYN, but it's very challenging. It takes a lot of dedication because of the time and the multiple tasks that you're expected to do, as well as the expected levels of expertise you need to accomplish during the residency period, from delivering a baby to doing a laparoscopic procedure. I think it makes our field amazing, exciting, but it's a little chaotic at times. So people have to be in a mindset of being pliable and being able to move from one thing to the other. And in saying that, you're also looking for an individual who really understands the what OBGYN means, what the residency will entail, and what your responsibilities will be to that residency. And I think there's a lot of factors. So they want this person to be able to stay. So they know that they want someone who's going to fit in with the group that they already have. Because once you're interviewed, I have to tell you, that's the first step. I think getting that interview, now it's up to you, and up to you saying, do you want us? I think that most residencies don't see that. We start, do we want you? I mean, once we have you come in, it's more like, you know, we're selling ourselves for you to say you want to come to our institution. And I think that's what many students don't realize. They think that they have to showcase themselves, which yes, you do, but you also need to ask the questions of like, can you really be at this institution? And I think showing that your interest and that you really want to be there really helps with the ranking.
Thank you. So a great question that just popped up in the Q&A has to do with not so much the interview process, but our training in general. The question states that there's some talk about OB residency should be longer than 4 years due to changes in surgical training. Do we agree? And how can we further evaluate our training, or how can we further evaluate how much training the applicants are going to get when they come on interviews as far as surgery?
I'll just
Right now, the majority of residency programs are 4 years, but there is actually a move to not lengthen them, it's actually to shorten them. And that's still a debate that's ongoing. But there is in Jersey a program that is 3 years. So it depends on what you're interested in, but there are programs out there that are testing out and looking to redefine how actually OBGYN is taught.
And what Dr. Broig is, and I'll add to what Dr. Broig was saying, you know, this has come up. People think it's recent. It's not. This has been a 10-year discussion back and forth regarding should we shorten or lengthen, and also have the first 2 years having all OBGYN general, and then the learner determines what type of OBGYN they want to. Do they want to just do GYN? Do they want to become a hospitalist? Do they possibly want to do ambulatory? Or do they want a fellowship? And then they will be tracked. So that has come up for a lot of reasons. One is because our field is so broad, number one. The second is because of the cost that you all have incurred from medical student, from loans, from medical school. The other is that people are looking at how can we recruit and maintain good applicants regarding when there's a 4-year and then they feel as though they still need to have more training. I think most of your institutions that you're going to be applying to, you have to feel comfortable with, because when we get reviewed, that question, if our residents are getting enough surgical surgical training, is part of the evaluation that all residencies go through. Their numbers are also very open. It's an open book, so it's a question that you can ask the residency. But one of the things is to see if that residency is accredited, because if it's accredited, then the surgical training is adequate or above adequate. That's one of the ways that we can lose our accreditation, is if there's not enough surgical training at a specific residency. But it is something that is being discussed. I don't think that it's going to happen in the next 2 or 3 years. I think it's ongoing, because I think there's a lot of pushback on both sides of that. But you're going to be hearing it sometimes through ACOG and APCO, which is our other organization that looks at academic OBGYN programs. But I think for you, those are individuals who are applying right now, I think the main question is to ask that program, what is their surgical volume, and how do the residents feel when they graduate? Do they feel well trained? And you can get also a lot of information from the residents speaking to them directly.
Yeah, I completely agree. When I was interviewing, I would ask, I asked every program actually, and a lot of times they'll put it up whether or not, or how many in terms of cases and numbers the residents have received. And then I also try to get in touch with, or be friends with someone who actually graduated and say, hey, like, you graduated from this program so and so many years ago or last year, like, how do you feel? Did you feel comfortable when you graduated with the surgical skills that you had? Did you feel comfortable being a brand new attending in terms of surgical skills, managing your patients? What do you think about this program? But specifically ask, do you feel comfortable graduating? And see what they say. Most residents will be pretty open and candid with you. We know it's a huge process, and you want the best for yourself and the best training for yourself. So ask, find those people, network. And I completely agree with Dr. Ayers. The information's out there, and you can ask the resident program director or the residents when you go, or when you interview.
Right, completely agree with that. The residents are a great source of information. You can also ask fellows, something to also consider. I know for my program, we didn't have any fellowship programs, so all of our surgeries that were being done at the hospital, we were the first assist, if not the surgeon doing them. So also something to consider. You know, a question, how many surgeries do you do, and then what also is your role in those surgeries, is a great question when you're interviewing. Any other thoughts before we move on to another question? No. Awesome. So What are your thoughts on second looks? Obviously, these wouldn't be done in person, but as far as reaching out after the interview, what are your thoughts on what are appropriate ways to do that? And ultimately, should residents or should applicants try to schedule another, in this case, Zoom session or opportunity to speak with more individuals?
So pre-COVID, second looks were basically an opportunity for you to come back and kind of get your feet wet on the floor. At least at Robert Wood Johnson, the second look students that come get immediately thrown onto L&D, walking around with the team. They scrub into, or they can't scrub, but they go into the C-sections to observe. They can go into the GYN side and see surgeries there too. So in that, how it was before, that was just a good way to see how people are really every single on their day to day, like how they really act when they're faced with pressure, and how you can see how the program, how busy it is and how you can fit into that. Now that second looks are going to be essentially virtual, I am not exactly sure how beneficial it may be. I'm not saying not to do it, but it's not going to be the same exact experience. And then the other thing that you have to be aware of with a second look, it's basically going to be like a second interview. That's how it was when pre-COVID, like, of course you're getting a feel, but they're also seeing how you are and see how you handle stress and how you handle a busy floor or a busy OR day. So just keep in mind, it could make you, but it also could break you.
Okay, and then another question coming from the Q&A, and it's kind of more tailored towards practice, but some programs emphasize robotics versus straight stick laparoscopy. What do we all think are some of the advantages or disadvantages of those?
Well, I think you have to take into consideration, you want to get the broadest experience, I think, in residency, so that you can want to the things you want or not do, or what are the things that you require to be able to do in the hospital or in the practice that you choose. So I think that it is something that you would want to look at, but you also want to see, well, how is that training? Is it just that there's robotic surgery, but you as a resident don't have the ability to actually do it because there may be junior attendings or fellows that are actually being trained to do robotic surgery? It's important to distinguish what level of learning you'll be able to do.
And I have to say also on that note is that I do a lot of credentialing for new faculty. And even if you have to, I think it's great for you to have robotics and for the assisting, but for you actually do robotics, unless you have a really good program, the information is needed for how many patients that you actually did. And in our institution, they look at the number you've done within a year process. And I think it's a very difficult number for someone in residency to accomplish. I think once you have, though, that basic information, I think it's to at least have the exposure and to have a clear, defined curriculum, I think is a really good component of a good residency. But I don't know if you can say that once you finish that residency that you will go ahead and do robotics unless you have partners who can help you move to that next level. But I think having that skill set helps you so that your partners can help you move to being a robotic surgeon or getting other specialized training. So I think in this day and age, to have robotics available is a very positive, but I don't know if you should use that as a negative and not rank a program because of that. But I think it's more on what you view yourself, what you want to do in the future as well. That might be something that's really important to you. So if it's really important to you to be a robotic surgeon, then probably that residency program that has more resources for that is the program you should rank higher.
I completely agree with that. As someone who just completed credentialing, robotics was very difficult credentialing process as a new graduate. And even though I feel generally comfortable with the robot, you do have to have a certain number of cases. You have to have gone through the training. You have to have done, gone to a conference and gotten that training. And as especially with COVID, some of those trainings just weren't available at this time. And so I wasn't able to ask for that credentialing.
And I don't think that's something that we share enough with, but sometimes even with residents, that credentialing. But I think if any credentialing that I've done over the last 20 years, robotics, because of the case mix now, and when we can, as generalists, do robotics is now limited. It's even more so going to be limited for our future gynecologists to do it, other than for someone who specifically, or our GYN oncology colleagues. So I just have to let you know that this is an evolving regarding who does robotics and what cases are in robotics, and it's impacted on credentialing. So I think it's going to also be more difficult for our residents to get as much exposure to it. But I don't think it's going to be totally out. And I think if that's something you want to do, then I think there are still some programs that have strong robotic training and are training their residents very, very well.
Agreed. I think it takes some onus on the individual to pursue that training, and really asking attendings to put them on the robot, and then pursuing some of those conferences, but it is doable. We're almost to 8 o'clock, and there is a question that multiple people have asked in the chat, so I do want to get to that one. If an applicant is interested in pursuing a fellowship potentially, what are some of the pros and cons and things they should be looking into for the programs that they're applying to? Should they be going to a program that has fellowships, a program that doesn't have fellowships, and what should they ask in their interviews?
I think for people looking to do fellowships, it would be great if you get into a program which has a fellowship program. But if you don't get into one, it's not a deterrent that you can't. There are different things you can do. Basically, it's all about, standing out amongst the applicants. And for starters, when you start your residency, probably by middle of your first year, you should begin to talk to your oncologist at your institution as to what can you do to essentially put together a dossier or put together an application towards the end of your third year when you'll be applying for the fellowship. Classically, most people want to make sure that you've done some research, and most of the time it's clinical type research, in the residency. Now, some people may be MD, PhDs who have done some bench work, which is fine, but in your residency, you probably should, start to work on 1 or 2 research projects. And number 2, you have to make sure you go to national meetings to present. SGO, for medials, for oncology, and MFM, Repro Endo. You got to look at those, conferences where you showcase yourself, either a poster presentation or, a regular presentation as well. Get an abstract accepted. And so you got to work with a faculty at your institution in that subspecialty, at get-go. so that you prepare yourself for the, I call it D-Day, to come. Because to be honest with you, it's highly competitive, highly competitive. I mean, classic example, this year, I had 56 applicants for one spot. And we ended up interviewing 20. But there's a bright spot. To be honest with you, we have great, diverse candidates. Of the 20 applicants we interviewed, half of them were minorities. So I think the picture is changing. When I interviewed for the specialty, probably you can count on one hand how many of us were in the group. But I think over the years, the numbers have changed. And I think it's due to the fact that we have great applicant pool going to med school, getting to good residencies and applying. But what I tend to see is that most of the minority applicants are still not doing the research part, which makes them not look competitive, on paper. But I think when you talk to them, you realize that they have a lot to bring to the table. So that is also helping to change the dynamics. But for advice, talk to the specialty people at your institution from day one. Begin to plan your course of how you're going to get yourself together and make sure you have a strong application.
Excuse me. I would recommend that if you're interested in a fellowship, you either attend an institution that has that fellowship, or an academic institution where you could do research. I think coming from a community program, I think it makes it harder unless you can get a strong affiliation with a program director from that fellowship that you are interested in.
I have to agree both with Dr. Akins and Dr. Brugh. I think the academic residency programs are probably the best, but one of the things that you can ask a program director is how many of their residents went into fellowship. I think that's a really fair and good question. And you can use that, and where did they go and what type of fellowships, because sometimes that shares with you the contacts that some of the faculty have that you can kind of tap into. And people have, I think if you haven't heard us saying, relationship building, communication, asking questions are so important. And this is one time trying to get a fellowship, connections are absolute and very important part of the process.
Completely agree. Having come from a community program, there was one particular fellowship that we tended to match into, but the others were very difficult. And I think we made it very clear to applicants that if you were interested in MFM, great. We've done that several times, and you can help you pursue that. It is going to take a lot of work coming from a community program on the individual, because you have to get that research and whatnot in, but it was something that was an option. So totally fair game questions to ask on your interview day. It looks like we've answered all the questions, and it's now after 8 p.m. So I want to thank everyone. I want to thank the attendees for joining us. And I want to give a special thank you to all of our panelists for taking time out of your day to answer all of the questions and share with us some of your thoughts. So we appreciate it. And again, on behalf of Tour for Diversity, SNMA, and LMSA, we want to say thank you and thanks for joining us. Have a great evening.
Good night, everyone.